I am here again today with Bonny Specker, epidemiologist, who is going to give us an update of what has been happening with COVID-19 over the last week. And also, she's going to talk to us about some things about vaccination, some questions that people have that continue to be asked over and over and over again. So some information to answer some of those questions that you may still have about vaccinations. Bonny, tell us about those questions.
Thanks, Chelsea. Yeah, I saw this article in Science News from May 11th, and I thought it would be a good article to just briefly summarize today. The title of the article is As the COVID-19 Pandemic Evolves, We Answer 7 Lingering Vaccine Questions. And that link to the article is here. And if people want to see it, it is easily accessible. There's no charge for it. It's publicly available. But it is a good article and goes into a little bit more depth than what I'm going to go into. The first question they talk about is how long does immunity last? And the short answer is that that's not known. This whole thing, people have to remember this is a new virus. Things have been moving very quickly. There is, however, a small study. It was only on an N of 19, and in epidemiology, we would sort of say, it's really hard to make conclusions based on that small number. But this was a study on 19 people who had the infection naturally. And 1 year after they were sick, 17 of those 19 people did have antibodies to the virus still a year later. But they found that the more severe symptoms, the higher the antibodies. So the people that were the sickest had the most antibodies. So if you have had COVID and you weren't very sick, those antibodies are likely to be low. Now, as far as the vaccine, the mRNA vaccines, those are the Pfizer and the Moderna vaccines. They have found high level of antibodies at least 6 months after the vaccine. And it's only 6 months because, again, that vaccine hasn't been around a long time. That both Pfizer and Moderna are monitoring this in their original trial. So that's good to know. And those data are continuously coming out. The second question was if they didn't, people who didn't have side effects are worried about whether or not the vaccine's working. The short answer, they said, was yes. And an example they gave was that in the Moderna trial, which involved 30,000 people, 79% of the people who got the vaccine had side effects. So 21% of them didn't have any side effects. But the vaccine was found to be efficacious in 94% of the people. So obviously, some of the people that had no side effects, the vaccine was efficacious. It's also important to remember that in that trial, people were randomized to either the vaccine or to a placebo, which is just essentially a saline injection, and you don't know which one you got. 37% of the people who got the placebo also reported side effects. And you see this a lot, and that's why it's important to do clinical trials where you have a placebo so that you can sort of pull out the effects of the vaccine, above and beyond what you see with the placebo. Third question, should I get an antibody test to tell if the vaccine worked? And the short answer to that, they say, is no. And the reason is that the antibody tests that are currently out there on the market don't test for antibodies to those made after getting vaccinated. The vaccine creates antibodies to the spike protein, those proteins that surround the virus. And the current antibody tests for the SARS-CoV-2 virus are looking at antibodies to the viruses in protein, this nucleocapsid. So it's going to be looking at measuring two different things. Now, if you had the actual virus and became sick with it, the antibody tests that are out there could test whether or not you have antibodies, because you've got antibodies to that N protein. But the vaccine's not going to give you antibodies to that. It's going to give you antibodies to the spike protein. So if you've had COVID, do you need to be vaccinated? And a lot of people, I've heard a lot of people asking this, and the short answer is yes, it's important that you get vaccinated. Those vaccines, the Pfizer and Moderna, they make more of these neutralizing antibodies, the kind that stop the virus from actually entering the cell. And immunity from the vaccines is more robust or stronger than immunity from an infection. So it is important that if you've had COVID-19, that you do get vaccinated. And there's also some talk about the natural immunity against some of these variants may not be as strong as the vaccines immunity, to the variants. And another thing that I haven't heard a lot about, I thought this was really interesting, is whether or not the vaccine can help people recover from long COVID. And the short answer to that is maybe. And apparently, there's this evidence out there suggesting that people who are suffering from long COVID, the long term effects of COVID on the heart, the lungs, the brain, they're actually doing studies right now where giving these people the vaccine actually improves their symptoms from long COVID. So the vaccine is being used as a treatment for long COVID, which is pretty neat. And this article talks about how that could be happening. So if people are interested in that, they might want to look up the article. The sixth question, can the current vaccines protect me from variants? And the short answer to that is, as of now, they can. The current vaccines have been shown to be effective against the current variants of concern, the UK variant, South African, Brazilian, and they're effective especially for moderate to severe COVID. So the overall effectiveness in terms of becoming infected isn't as high with these variants. So instead of 94% effectiveness, it might only be 89% for actually becoming infected. But if you become infected, you're much more likely to have a less severe case of COVID. So it is important to get these vaccines to protect you from the variants. There are some trials currently going on. The article talks about ones that Moderna is currently doing that have used combinations of the different variants in their mRNA, so in order to protect better against some of the variants. Also, it's important to realize that the fewer the people that are vaccinated and the more this virus spreads, the more likely there is a variant that becomes prevalent that may not be, the vaccine may not protect against. So it's important to get people vaccinated. The seventh question is it possible to reach herd immunity? And this relates to somewhat what I talked about just now. First of all, the short answer is we don't know. And we know that the more contagious variants require a higher percentage of the population to be immune. So originally, the estimates were that for the wild type, the original virus, 60 to 70% of the population would need to be immune in order to reach this level of herd immunity. But now with the UK variant, that's up to more than 80% because that variant is a much more contagious virus. So the more contagious the virus is, the higher the percent of the population that needs to be immune. And this now is the most dominant virus present in the United States. And based on what I've heard Josh Clayton, the state epidemiologist, say, it's my understanding that it's also the most dominant virus in South Dakota currently, or they're thinking that it is. There is a goal out there right now of vaccinating 70% of adults by July 4th. What's important to remember there is that 70% of adults is only 55% of the total population. And when we talk about herd immunity, we're talking about the total population in the denominator, not just adults. Either way, Fauci just came out with this, and I think this is also a very important thing to remember, that when you vaccinate enough people, the infections are going to go down. And this thing with herd immunity, it's not like you don't have herd immunity and then all of a sudden you have 70% and you have herd immunity, or 80%. It's a gradual thing. So the higher the percent of the people vaccinated, the more you are moving towards that herd immunity, and it's not just a yes, no, it's a continuum. So that's important to remember. So no matter whether we reach 80%, hopefully we do, but the more we have, the better we are. As far as the weekly summary, this is as of yesterday, May 19th. Brookings is still doing well. I was hoping we were going to get into minimal spread, but we're still in moderate spread. We had a couple more cases this past week than the week before, 11 cases this past week compared to 9. You can see that we're a lot better off than we were back here in the fall, and even just in the end of March and early April. If you look at the hospitalizations in Brookings, we had fewer this week. We only had 2. The week before we had 5. No deaths, and we haven't had any deaths for quite a while. But the hospitalizations, I still think these seem to be running high considering how few cases we have, but hopefully this is going to continue to decline. If you look at the state's doing good. We've had declines for the past 6 weeks. It's been declining. There were 325 cases last week compared to 424 the week before. So we're definitely going in the right direction there. If you look at hospitalizations, this past week, we had 53 hospitalizations, down from 66 the week before. We still have about the same number of people in the ICU. This ICU is the yellow line here. The blue line is those that are currently hospitalized, so that's been dropping. But we've had about the same number of admissions this past week as the week before. If you look at deaths, we had a lot fewer deaths this past week. We had 6 deaths compared to 14 in the week before. And we're going to reach that 2,000 death mark probably in the next month easily, probably in the next week or 2. This is one of the slides that were updated. There were a lot of slides that are posted on the city website that were updated this past or yesterday. The mortality data, this is one of several slides showing mortality data for South Dakota, but I also updated the mobility slides. How much are people moving around, both in Brookings County and the state? So if people are interested in that, they can look at those slides. But this particular slide I thought was kind of a nice one to show. This is the deaths per 100,000 population, and it's between 1960 and 2019, looking at those averages. And the reason we do it on a per 100,000 population is the population of South Dakota has increased over the last 40 to 50 years. So it's important to adjust for these changes in population size when we're looking at number of deaths. So we're dividing it by the population to make it more comparable. And if you look at the average, that's this solid white line. This is the average number of deaths per population size throughout the year by month. And this dotted line is the highest, and the dashed line is the lowest. So this is the total range in the number of deaths. And you can see this blue line, this is in 2020. And back in July, we started going up. By September, we were higher than we had ever been in terms of the number of deaths per month. And the peak was in November. That was when we had the really large outbreak. And December, the number of deaths were still quite elevated, as was in January. But by January, we were below the highest, but we're still quite a bit higher. In February, we were getting close to what the average was, and here in March, we're about where the average is. So, this is all a good sign where we're getting back to, normal, at least in terms of the number of deaths. So that's good to know. Also, just an update on the percent of the population, both South Dakota and Brookings, that's been vaccinated by age. These two numbers actually last week went up quite a bit. A lot of the 30 to 49-year-olds in Brookings got vaccinated recently, which is, a big kudos to them for getting out there. It still would be nice to get these age groups up above 70%. And we're still having low numbers of the 20 to 29-year-olds that are being vaccinated. We're below the state average there. But in all the other age groups, Brookings County does have a higher percent vaccinated. And one of the things I also did in all the vaccination slides that are posted on this website is I used to put it per population aged about 16 and older, but I've now made it over the total population because a lot of people don't realize that that's really the percent that's important when we're talking about herd immunity. So when you say 60% of the population, adult populations immunized, that sounds really good, but that's a lot lower percent because you're not including those children in that number. If you look at the United States, we've also declined, for the last 6 weeks. This looks just like South Dakota's decline. 224,000 cases this past week compared to 275,000 the week before. In terms of deaths, we're also going down, not quite as rapidly yet, with about 4,400 deaths this past week and the week before. We've now gone over 600,000 deaths in the United States from this virus. This number is a little bit higher than what the CDC posts. From the very beginning of this pandemic, I've been using data on the Worldometer, which is one of the sources of data, Hopkins, that database. So there's tends to be a little bit different numbers. The CDC numbers are given on one of the slides in the weekly summaries. If you look at the number of cases worldwide, this was great news. We had a big drop here. There were 4.5 million new cases last year compared to 5.3 million the week before. So hopefully this continues to decline as well. And the number of deaths have started to decrease, but we're still hovering around that 88 to 90,000 deaths per week worldwide. So I still think it's important that people think about their neighbors, and maybe one of these days we can talk about that. But I think it's important to get vaccinated and encourage your family and friends to get vaccinated. And to also be smart about what you do. We still can't forget about those public health recommendations to slow the spread of this virus. I think we don't want to let our guard down too early. We want things to continue in this direction that we're seeing them go right now.
Yeah.
That's all this week.
Yeah, exactly, Bonnie. You know, the vaccination numbers are going up, but they're not at 100%. So it is still important to remember though to still be socially responsible, as you mentioned. And also, I just want to remind people that today there is a walk-in Johnson & Johnson vaccination clinic for the pod at Swift Health Center. I'm posting the website to that in the description of this video. So if you want more information on that, you can visit that link. But yet today, Thursday, there will be a Johnson & Johnson walk-in clinic that is a 1 dose for 18 and over. So for individuals that are interested in that, they can go get that today if they would like, just by showing up. So have a wonderful week and have a great weekend.